friends, today's topic of discussion is a homeopathic medicine, that is Thlaspi bursa pastoris. It is also known as, or a common name of Thlaspi bursa pastoris is Capsella bursa pastoris. It is also known as Shepherd's purse, P-U-R-S-E, Shepherd's purse. Natural order, or it is belonging to a family that is cruciferous family, and the preparation of plant tincture of the medicine is being prepared from the fresh flowering plant. Okay, this medicine is anti-hemorrhagic remedy, or it is also known as anti-uric acid remedy also. Now we see the clinical conditions which are being included in this remedy. So here are the clinical condition. First, this Thlaspi bursa pastoris is indicated in cases of abortions, then hemorrhage after abortions, then dropsy, dysentery, dysuria, fibroma. It is a very good remedy for the uterine fibroids, gallstone, gonorrhea, then hematuria, leukorrhea, uterine hemorrhage from the affection of cancer, means CA of uterus, and because of that there is bleeding is there from the uterus. So in that situation also this remedy is going to help. Then liver affection, metrorrhagia, menstrual irregularity, heavy painful periods, then ranula, renal caliculi, strangury, painful urination, painful micturition, then uric acid diathesis is there in this remedy, and lastly it is also indicated for the wheat low, means infection of the nail. Now we discuss the important clinical symptoms where we can use this Thlaspi bursa pastoris. As we see earlier that it is an anti-hemorrhagic remedy as well as anti-uric acid remedy. Clinical conditions or clinical situations, or you can say the clinical symptoms for on the basis of what you can prescribe this remedy. The first is hemorrhage from uterine fibroid. A female who is suffering from uterine fibroid and having complaint of heavy bleeding, then dysmenorrhea, painful bleeding, in that situation you can use this Thlaspi bursa pastoris even in mother tincture also, and it will give good result. Another symptom is uterine bleeding with cramps and expulsion of clots, with back pain, general bruised soreness. Okay, a patient having, along with the uterine fibroid and heavy period, patient having cramps and expulsion of clots with back pain and general bruised soreness all over the body. Patient feels soreness. Also, patient having the aching pain between the scapula. You can see in Thlaspi bursa pastoris that patient having the effects of suppressed uterine disease. Whenever any kind of uterine disease and that disease is being suppressed, so the consequences are being observed in those patients. Okay, or a suppressed menses, which is said by Dr. Burnett, means you can take it as one of the indication that whenever there is an effect of suppressed uterine disease, and whenever a lady who suppresses her menses, okay, so in that situation you can use the Thlaspi bursa pastoris. Patient having profuse uterine bleeding, frequent copious menses. Patient having metrorrhagia with dark offensive menstruation, bleeding with vertigo on rising. Whenever patient tries to rise from the surface, patient develop the vertigo. Along with that, also patient having white discharge, or you can say leukorrhea, before and after menstruation. Patient develop before and after menstruation leukorrhea. Mother tincture of Thlaspi bursa pectoralis is enough to control the uterine bleeding successfully. In heavy uterine bleeding, 10 drops of Thlaspi bursa is to be taken twice a daily, and you can observe the good result. That much indications are there in uterine fibroid of Thlaspi bursa pectoris. Okay, so much specific remedy for the uterine fibroid, and these are the indications where you can give the mother tincture also. Then patient develop albuminuria during gestations, chronic neuralgias patient having. Also there is a renal and vesicle irritation. Urinary symptoms are also observed. Then a specific indication is that patient of Thlaspi bursa pectoris craves buttermilk. Specifically, buttermilk is liked by this patient. This Thlaspi bursa pectoris removes the ill effects of suppressions of hemorrhage or vaginal discharge from uterus. Okay, whenever any suppressed discharge or any condition which is being occurred due to any suppressed discharge, so it will recover from that the medicine is Thlaspi bursa pectoris. You can say that profuse passive hemorrhage from every outlet of the body means anti-hemorrhagic medicine means any of the orifice of the body like nose, mouth, ear, vagina, rectum, okay, anal canal. So every outlet of the body, patient develop the profuse discharge which is of a blood which is passive hemorrhage, and the character of blood in that discharge, blood is dark and clotted. A female developed the metrorrhagia, heavy, irregular, painful menstruations with violent cramp and uterine colic. Uterine colic, especially in chlorosis. Okay, and that uterine cramps which are developing after abortions, after labor, or after miscarriage. એનિમિક લેડી હોય અને એમાં મેટ્રોરેજિયા હોય, અથવા તો દેટ કાઇન્ડ ઓફ metrorrhagia, that kind of metrorrhagia is developing after abortions, after labor, or after miscarriage, you can use the Thlaspi bursa pectoris. Or this kind of metrorrhagia may be developing at the climatic age, whenever there is cancer of uterus. Okay, in cases of cancer of uterus, metrorrhagia at the climatic period or climatic age. Another remedy for the same conditions are phosphorus and ustiligo. Lady having menses which is too early and too profuse. Protracted means lady has become so much weak sometimes, and the duration of period, sometimes it is of 8 days, sometimes 10 days, sometimes even 15 days menstruation is being continued. કેટલાક દિવસ, કેટલીક વાર 8 દિવસ, 10 દિવસ અને કેટલીક વાર 15 દિવસ સુધી પણ મેન્સ્ટ્રુએશન એનું ચાલુ હોઈ શકે. That kind of heavy bleeding may occur. Okay, and that bleeding is tardy in starting. જ્યારે પણ સ્ટાર્ટિંગનું ફેઝ હોય મેન્સ્ટ્રુએશનનો, in that phase the bleeding is tardy. First day merely you can observe that only the show, SHOW, show means a thin reddish watery liquid which is come out from the vagina. On second day patient develop the colic, sometimes vomiting, and on second day patient or a lady develop hemorrhage with large clots. Okay, first day merely the show, second day along with the colic, vomit and the vomiting, patient develop the hemorrhage or bleeding from vagina with large clots. Each alternate period more profuse मतलब more profuse hemorrhage or delaying menses from uterine inertia. Sometimes these menstruations may be regular, sometimes irregular, and sometimes what happen કે પેશન્ટ એક મેન્સ્ટ્રુઅલ ફેઝમાંથી હજી બહાર નીકળી નહીં હોય કે તરત જ બીજું મેન્સ્ટ્રુએશન એનું સ્ટાર્ટ થઈ જાય. સો વેરી ઇરેગ્યુલર પીરિયડ્સ, very exhausting period, scarcely recover from one period before another begins. What I said earlier that પેશન્ટ એક ફેઝમાંથી બહાર નથી આવી કે બીજો મેન્સ્ટ્રુએશનનો ફેઝ એનો સ્ટાર્ટ થઈ જાય. લ્યુકોરિયા which is also bloody, dark, offensive, some day before and sometimes before menstruation and sometimes after menstruations, or sometimes also before and after leukorrhea is also there. Okay, you can compare this remedy Thlaspi bursa pastoris for this condition with synapses, then trillium, viburnum and ustilago. It is mainly indicated remedy or therapeutically used for the uterine fibroid, but urinary symptoms are also very important or very peculiar in this remedy. So let's see the urinary symptoms of Thlaspi bursa pastoris. Patient having frequent desire for urine. This urine of that patient is heavy phosphatic urine. Then patient having complaints of chronic cystitis, inflammation of bladder, and patient suffers with that chronically. Dysuria, painful micturition, then spasmodic retention of urine, sometimes presence of blood in the urine that we can say is hematuria. Then accumulation of granules means patient also having the complaints of renal colic, renal stones, brick dust, sediments are also found, and urethritis also there. Urine runs away in a little jets, drop by drop or small streams of urine is followed, and it often, this remedy is very specific or very indicated in this kind of symptomatology, or it often replaces the use of catheter. Sometimes allopaths say that in that situation you have to insert a catheter to give relief to the patients. So at that time you give the Thlaspi bursa pectoralis on the basis of indicated symptoms. So in that situation you can avoid the use of catheter also. Okay, if you give this Thlaspi bursa pectoralis before any surgery, okay, so if you given already, then it will prevent the passive hemorrhage. means કોઈ પણ સર્જરી થયા પછી જે પેસિવ હેમરેજ થતું હોય તો એ પેસિવ હેમરેજ અટકાવવા માટે પણ આ મેડિસિનનો યુઝ થતો હોય છે, લાઇક બિફોર ટૂથ એક્સટ્રેક્શન્સ, લાઇક બિફોર એની સર્જિકલ પ્રોસિજર, લાઇક બિફોર એની સર્જરી ઇન નોઝ. ઇફ યુ given already this Thlaspi bursa pectoris, then it will prevent the hemorrhage. Nose, specifically symptoms of nose, that bleeding in a nasal operations, especially it prevents the passive hemorrhage. So you can use as preventive of hemorrhage before any kind of surgical procedure. Now male symptomatology, that is spermatic cord is sensitive to concussions, and this kind of concussions are usually occur while walking and while riding. Now we discuss see the head symptoms, that the patient's eyes, face has become puffy and frequent epistaxis from the nose, patient having vertigo, worse while rising, જ્યારે પણ ઊભા થવાની ટ્રાય કરે ત્યારે વર્ટાઇગો વર્સ થાય. Then this vertigo is worse towards evening. Patient having or developing the scaly type of eruptions behind the ears from which the scales are being expelled. Tongue of that patient is white coated and mouth and lips are being cracked. Sharp pain, patient having sharp pain over the right eye and right eye drawing eyes upwards. Means patient having sharp pain over the right eye and the eyes are drawing upwards. Now we discuss in a nutshell that therapeutically what symptomatology is there, and you have in that situation you can prescribe this Thlaspi bursa pectoralis. So first is menses, which is appear frequently at short interval. Then menses, which is menses contain the large clots, and in menses having dark red blood, and patients has barely recovered from one period and the next appear. These are the four symptomatology. On basis of this symptomatology, you can use this Thlaspi bursa pectoris as a specific therapeutic remedy for these female complaints. Thank you.